trying a new camera angle today. Let me know if you prefer this portrait orientation or if you'd rather it go back to landscape, because now that I'm not on YouTube, it doesn't matter as much, does it? Today I'm going to be talking about 2 exciting success stories that we've had at the office, and also concussions. Hey, I'm Dr. Patty Barch. I'm a traditional naturopath, founder and owner of Naturally Unbridled Wellness and naturallyunbridled.com, where we focus on wellness solutions, not disease management. This is Down the Ridge with Dr. Patty. This is not medical advice. It's for entertainment purposes only. Nothing I say is true. Don't listen to me. I guess you guys don't have as good of a view of the beautiful scenery in this orientation. But anyway, I'll look for your feedback. Okay. A couple of really great success stories. So you may have seen one that we posted yesterday of a little boy, 4.5 years old. The parents noticed he was mouth breathing and teeth grinding, and he was wetting the bed a lot. And they took him to a specialist, and they didn't really make any progress there. And they were told that the child's tonsils were so swollen that they were basically obstructing his airway, and that they would probably need to surgically remove his tonsils. And I think we've talked about the fact that tonsils are the gate, right? The tonsils are what keep infections out, or at least identify the infection to mobilize the immune system to help fight the infection, right? So your tonsils are super important. And the parents are, very holistic minded. They're not going to not do surgery if they need to, if there's nothing that will work, but they're going to try to do some natural things first to help the child so that the child doesn't need surgery. So they brought the child to Naturally Unbridled Wellness, and we started the kid on a few different remedies and did our Firefly high intensity LED light on the sinuses and on the tonsils. And they noticed improvement after the first session, and then came back and did subsequent sessions, and the tonsils are remarkably smaller, and the child has not wet the bed since the first Firefly session. We find that we've done a lot of bedwetting protocols, and sometimes it's just communicating the bladder and the brain. So we'll do like PEMF, laser, Firefly, any combination of those things on the brainstem and on the bladder, along with some remedies to help support the urinary system. But hang on, I gotta make sure. You gotta look out, squirrel. There you go. In a certain percentage of cases, we didn't have success. And what I realized is these are likely, and we've proven this to be the case in many cases. The child has these enlarged tonsils. They're snoring, they're mouth breathing. They basically have obstructive sleep apnea, and they're so exhausted from the sleep apnea, causing them to not sleep well through the night. They have all those fits of like slightly waking up because of the breathing thing, that the child isn't getting the message from the bladder. Jesus, squirrels are crazy. From the bladder to the brain. And so the solution in those cases is not to reconnect the bladder and the brain. It is to open the airway. So we use the tools that we have in the office to do that. So we're super excited. And the mom sent us a lovely picture and a great testimonial, and we put that on the Naturally Unbridled Wellness Facebook page, so you can read the whole story over there. And like I welled up when I read it, because I love helping people like that, especially little kiddos. The next story or testimony I want to tell you is about the husband of a client who had developed this really angry, like bright red, raw looking rash on his feet. Worse on one foot than the other, but on both feet. And I mean, I was like, holy crap, when I saw the pictures, because whenever somebody messages me like, hey, my husband has a rash, or my son has a rash, or I have a rash, I want to see the rash. And when I saw this, I was like, whoa, like, what are the medical people doing? Oh, athlete's foot ointment or cortisone cream. The athlete's foot ointment didn't help at all, and the cortisone cream helped but didn't solve it. And you know, there's downsides to using cortisone. Anyway, I put the guy on a nutritional program of some herbs and homeopathics, and it was like, it's so crazy. It was like, I would say 85% better in like a week. Maybe it was 2 weeks, but like, I can't remember exactly, but a very short amount of time. And during that time, I think it was 2 weeks, but during that time he had gone on vacation to Vegas for 5 days and forgot to bring the stuff with him, or didn't bother because, you know, it's vacation, give yourself a break. But anyway, those were exciting things. So it helps to want to keep going to work when you're having crazy success stories like this. And I know we love your testimonials, and if you would share them, it will help others to learn what we do and how we help. And we'll be able to help more people. The last thing I'm just going to talk quickly about today, because I ended up telling those stories longer than I intended, is concussions. So when we get a call that somebody's had a concussion, we definitely want them to come in and do hydrogen. We want them to do laser or firefly on the head. We may not do PEMF on the brain right away, but we may incorporate that on a case-by-case basis. But we're also going to recommend neuromag, which is a form of magnesium that crosses the blood-brain barrier and shuts down a specific cascade of events in the brain that can be detrimental. We're going to ask them to consider Mastermind, which is my high DHA fish oil, which is really good for the brain. So we'll do high doses of that. We're probably going to recommend liposomal glutathione. Liposomal will also cross the blood-brain barrier. Glutathione is the master antioxidant in the body, so we'll probably recommend that as well. And we may recommend some CBD because there's really good evidence about the benefits of CBD for concussion, to the point that it has been, I don't know if it is now, but it has been part of an NFL protocol for concussion to use CBD to help with that. So those are just some quick updates, and yeah, let me know what you think about this vertical orientation of the camera, or if you like the landscape version better. Peace out, peeps. Have a healthy day, make healthy choices, raise healthy kids, and create your heaven on earth.